You have the power to prevent disease by eliminating unhealthy lifestyle choices and to replace bad habits with smart health choices. Hello, I'm Chris Everett, and you're watching Today's Health, the show that gets right to the heart of matters concerning your health. Our first story shows the steps we can take now to better our overall health and well-being in the future.
Would it surprise you to find out that oral cancer is one of the deadliest forms of the disease? According to the Oral Cancer Foundation, it will cause over 8,000 deaths, which translates roughly to one person every hour of every day.
One reason for oral cancer's high mortality rate is the fact that roughly 2/3 of the time the disease is not detected until late stages. It is not something to be taken lightly. Pauline Sterling knows all about the effects of oral cancer.
Well, I came in to do a regular dental checkup, and I'm a cancer survivor, and the last thing on my mind was to find out that I did have some cancer in my mouth, a precancerous at that stage.
Pauline is a patient of a colleague of mine, and upon a routine checkup, he found an area of concern. He wanted me to check out that area, and I used the VELscope to look at her tissues, and the area that he had a concern of actually was fine, but I found another area that had deep concern. We decided to do a biopsy, and the biopsy came back as precancerous dysplasia. Luckily, the biopsy showed that we were able to remove it before it became cancer.
While the majority of patients who develop oral cancer are over the age of 40, the number of younger people being affected with this disease is growing. As reported in the New England Journal of Medicine, at least 2 versions of the human papillomavirus, or HPV, which can be sexually transmitted, have been shown to cause oral cancer in young people who don't use tobacco products. The VELscope oral cancer screening system adds only 1 or 2 minutes to a conventional oral cancer examination. It helps identify dangerous tissue changes in the mouth that might have been otherwise missed.
This device helps me see cancerous or precancerous lesions that I normally wouldn't be able to see with my eyes. I'm not going over the top by saying this screening tool should help me save lives.
To the naked eye, abnormal tissue may remain hidden. With the VELscope, however, it typically appears as an irregular, dark area that stands out against the green fluorescent pattern of surrounding healthy tissue.
Mortality rates for oral cancer have remained unchanged for the last 30 years. The VELscope should help us reduce the number of patients that are affected by this deadly and disfiguring disease.
When I first went to see Dr. Perella, I was frightened. I didn't know what was happening. And I was so relieved when he told me that it was precancerous and they had gotten it in time. It could have saved my life.
This new, convenient, painless screening device for oral cancer is now available to patients. If you feel you would benefit from this procedure, talk to your dentist.